Healthcare workers have taken care of COVID-19 patients for almost 2 years now, and the Omicron variant is bringing its own set of challenges to those on the front lines. As one UAMS employee told THV11's Mercedes McKay, the amount of patients they're seeing right now is overwhelming.
We're all exhausted. Our families miss us. I miss having dinner with my children. I miss doing homework with them. And we just have to put all of that aside right now and fight through this together.
It's a daily battle inside UAMS's COVID-19 unit.
In my 20 years, this last 2 years has been the hardest. Just the most stressful, I guess you could say.
A battle not only against the disease,
our patients are sicker and there are more of them,
but a battle within themselves.
You have to remember at the end of the day, like, I'm here because I want to help these people.
Gina Boshiers has been in healthcare for over 30 years. This disease altering almost everything she knew.
It wasn't anything that any of us ever saw coming. We always use the expression, well, before COVID, because it's as though it's changed healthcare entirely.
As clinical services manager, she knows firsthand how much staff is needed to take care of the surge of patients. And right now, they're falling behind.
Everyone is sick. I spend most of my time calling and asking people, begging people to come in.
The toll Omicron is taking on the staff means many respiratory therapists like Leslie Hallam are picking up at least one extra 12-hour shift a week.
It's just a different level of exhaustion. When you're at work, you're always critical thinking, but more so now.
Even when she's outside the hospital walls, it's almost impossible to escape what's going on behind the closed doors.
When you get home, you just try not to think about it, but it's everywhere, so it's hard not to.
While it seems as though this is never ending and the fatigue is taking its toll, some are choosing to walk away.
It's discouraging to see, so many people leaving the field in record numbers. It's really hard to see.
But many are ready to put on the gown and gloves.
This is the career field that I want to be in, and I want to care for patients. I want to take care of people and just love on them and help them get better.
In Little Rock, Mercedes McKay, THV11 News.
One of the things healthcare workers say is different about this time around is that the disease isn't as obvious. A lot of patients are showing different COVID symptoms, so the positive tests are a little more surprising.